At MMI, we continue to build on the idea of a collaborative treatment model, which includes providers from various subspecialties and disciplines together to create one source for bone, muscle, and joint problems. As a result, we've built a team of providers with backgrounds in orthopedics, rheumatology, pain management, physiatry, physical and occupational therapy, chiropractic treatment, skilled hand therapy, and pediatric therapy. While this may sound impressive on the surface, it's often difficult to understand exactly how it adds value to your patient experience. So I'd like to highlight a few key areas from the perspective of a physical therapist that really highlight the patient experience that you'll have. The first is communication. Given that we are all on the same team and we work under one roof, it's very easy to get our questions answered. Now, there may be a time during your therapy where we have a question about a possible wound infection. You may have questions about your work restrictions, can I drive again? Maybe just a simple medication question. Instead of having to pick up the phone and call an outside provider, a lot of times we can walk straight across the hall and get an answer to your question before you even leave your session. This improves your experience and it cuts down on your wait time to get your questions answered. The second area that I feel is important is the fact that we have an in-house specialist for durable medical equipment, or DME. There may be a time where your doctor or your therapist feels that a certain brace or a piece of adaptive equipment, such as a neuromuscular stimulator, might enhance your recovery and decrease your pain. Normally, we would have to call an outside company and set up a time where you can meet with their representative, wait for authorization before you finally get your device. At MMI, given that you're already a patient and we have your information on file, we can usually fit you with that device the same day or next day. This allows you to have decreased pain, improves your overall outcome, and allows you to participate more fully in your therapy session. The last area I'd like to highlight is outcomes. And by outcomes, I mean the end result of your healthcare experience. A recent federal study pointed towards physician-owned clinics such as MMI, who participate in integrative care, as having the same, if not better, outcomes with fewer total visits. Now, in a world where healthcare costs are rising and those rises are often transferred to you as the consumer, fewer visits equals fewer dollars. Now, if we can provide the same, if not better, care than our competitors while reducing your overall cost and time, it's a win for you and it's a win for us. So while I sincerely hope that you never need our services, if you do find yourself in a position where you have a bone, muscle, or joint problem, we look forward to welcoming you and we promise to provide the best care that we can.